Time to start.
Okay, welcome to the lecture. Sorry I'm a little bit slow. Today's lecture is on diabetes. And diabetes is occurring more and more frequently. It's a group of diseases characterized by high levels of blood glucose, resulting in defects in insulin production, insulin action, or both. And the term diabetes describes a metabolic disorder of multiple etiology characterized by chronic hyperglycemia with disturbances of carbohydrate, fat, and protein metabolism resulting from defects in insulin secretion, insulin action, or both. Now, the term diabetes actually was an old term just meaning going to the bathroom too much, eating too much. And there's two types of diabetes. Diabetes insipidus, which is where the pituitary is messed up and you're not producing the antidiuretic hormone, and so you pee constantly. And so that's a defect in the pituitary. Diabetes mellitus is a defect either in the pancreas or in the insulin reactivity to insulin receptors. And so we're going to describe some of this. And diabetes causes a lot of long-term damage, dysfunction, and failure of various organs in the body. It may present as thirst, polyuria, which means going to the bathroom a lot, blurry vision, and weight loss. In its severest forms, ketoacidosis, non-ketotic, hyperosmolar state, and can lead to stupor, coma in the absence of getting insulin to these people. They can die, literally. Symptoms may be absent, and they can be changing to severe, and you can have diabetes without even knowing it. And the main thing people notice is they get a lot of tingling and numbness in their extremities, and sometimes even pain, because with chronic high levels of glucose you get glycolation of the nervous system, which causes dysfunction. So now in looking at this, boy, that didn't turn out very good. There was pictures here. I don't know what happened to them. They disappeared. But I'll find them for you here soon. This shows kind of how the United States population since 1958 has increased in the amount of people with diabetes. And this only goes to the year 2008. In 2013, there was over 30 million people in the United States, or 1 in 10 that have diabetes. So it's a huge problem. And 10 million, they figure it's 40 million, 10 million aren't diagnosed because we don't go to the doctor and stuff. So the types of diabetes are type 1 diabetes, which is insulin dependent, usually occurs in children, and they have to take insulin their whole life. Type 2 diabetes is adult onset, and there's a lot of kids getting type 2 diabetes now because of diet and weight problems. Gestational diabetes, which occurs during pregnancy, it makes the insulin not work as well, and so these women can run higher blood sugar levels. When I was an OBGYN, we had to deal with this a lot, and we had to encourage women to keep their sugars low, keep the amount of bread, pastas, and different things that raise sugars to a minimum, or their babies would get too big and they'd need a C-section. The biggest baby I ever delivered, it was kind of interesting. I was on call working at the Phoenix Indian Medical Center, and down in Phoenix, Arizona. And I get a call from the ER doctor saying, I've got a lady down here who came into the ER in abdominal pain. I think she's in labor, but I really can't tell because she's so big. And so I went down, and sure enough, there was a 450-pound lady. Took her up to the delivery room, and we delivered a 16-pound baby from this woman. She didn't even know she was pregnant. I mean, interesting stuff. So there's other types of diabetes that they're coming out with and looking at, and it's, you know, the main thing is that's for doctors, because they all like to categorize things and make them different diagnostic criteria. So this is an old one, 25.8 million. That's back in 2008. In the last 6 years, it's gone up to 30 million. And it's quite interesting. You know, the adult population, this is an old slide, so the adult population over age 65 now, they're feeling it's 13 to 14 million adults over age 65 that have diabetes. And this is an old statistic. They're looking at 500,000 kids having diabetes type 1 and 2. So that's more than doubled in the last 6 years. They're newly diagnosed. They're getting almost 3 million new diagnosed diabetic cases every year. That's 1% of the population.
Increase in sugar and carbs that we're eating.
Oh, absolutely, absolutely.
High fructose corn syrup. Yeah.
High fructose corn syrup.
When you're in the grocery store, when you're standing in line to check out, turn around and look around you and see what you can see. I did that the other day, and I could not see one thing that was good for anybody in sight.
Yeah, yeah, it's pretty.
That's scary.
It's pretty scary.
The ingredient in formula is high fructose corn syrup.
Yeah.
That's the one ingredient.
Yeah, at Walmart, that's what you're getting. And let me tell you, the amount of babies developing these things is getting higher and higher. The complication of diabetes, it's a major cause of heart disease, which is the #1 cause of death in the country, and stroke, which dropped down to #5. But you're more likely 2 to 4 times higher in people with diabetes. High blood pressure, you know, 67% of people with diabetes have high blood pressure. Diabetes is the leading cause of blindness in the United States. Outside the United States, it's infections. But you can go blind from diabetes. I get a lot of people coming in with eye problems, and a lot of it is too much sugar, and they get cataracts because it stimulates the growth of fungus in the body, and is a major problem. Kidney disease. Here in the United States, when I started medical school, maybe 1 in 1,000 people were on dialysis. Now we're down to about 1 in 70 people on dialysis.
Wow.
And most of this is due to diabetic kidney disease. It literally affects the kidneys to the point where they just flow fluid out without even filtering it. And so neuropathy, people with diabetes, 60-70% have mild to severe forms of nervous system damage. Amputation, it's the #1 cause of getting extremities amputated. The cost of diabetes, this is back 2012, $245 billion. And a lot of people, that's the diagnosed cases that they can actually add up. And direct medical costs, reduced productivity. People with diabetes, they can't work as well as those without diabetes. And it's the 7th leading cause of death. And that's pretty high when you think about it. Just dying from a diabetic ketoacidosis. In other words, you maybe missed a shot or gave yourself too much insulin. It's 7th leading cause of death now. Type 1 diabetes is called insulin-dependent diabetes mellitus, and usually starts as a kid. I've got a really interesting story. I had a family that had 12 children, and everybody but the dad and 1 child had diabetes. And intuitively, I felt like it was flukes. Got into their bodies, And flukes, pancreatic flukes, actually eat the beta cells, the islets of Langerhans that produce the insulin. And I told him, you need to do a parasite cleanse. And he didn't believe me. He says, but you know, I've been praying to God that my last child doesn't get diabetes and that I take it on myself, is what he said to me. Well, a month later, he came in and he said, guess what? I have diabetes. And the last kid got diabetes too. And I tried to get him to do parasite cleansing, which would have kept him and this last child from getting diabetes. But it was due to pancreatic flukes. So most forms of type 1 diabetes, I believe, are caused by pancreatic flukes. And they can get in babies, they can get in children, they can, you know, wreak havoc with the immune system, and they destroy the beta cells. Most doctors say, oh, it's autoimmune. In other words, they don't know what the heck causes it. But I believe it's pancreatic flukes. In some cases, it's a high fever with a virus that destroys the pancreatic insulin-producing cells. Yes?
The Native American people and then the white people, I know they have a real tendency to get diabetes.
Yes.
And it's huge.
Yes.
Would that make you more exposed to?
Oh, absolutely. Lifestyle and familial. You know, I was in St. Louis. I dealt with a lot of the African American population, and they did have a lot more gestational diabetes, regular diabetes, and most of them were really eating crap. I mean, you'd walk down the street from the medical school down to the hospital, and they'd be sitting out on their porch eating candy and donuts and, you know, grits and all the stuff that's really not good for the pancreas. And, you know, they had a major problem with diabetes. When I went to Arizona and did my residency, the Indians the American Indians had so much diabetes, and it was eating the great American diet, you know, the SAD diet. It's really kind of sad, but yeah, the American Indians, even Asians who start eating the great American diet, they get diabetes far more than
Are they
the
getting more
Caucasians.
now that their rice is being altered more? and more
Absolutely. They're finding that genetically modified foods carry with it the glyphosate and less of the nutritional value, and people who are eating GMOs and glutens are getting diabetes at an alarming rate. So it's
Because the Asians used to be able to live on rice, but they were never heavy.
yes.
In our my young
Yes.
years, you didn't see very few Asians that were heavy, but they were always big rice eaters.
Yes, and rice has been shown to be, you know, a fairly good protein, and doesn't cause spikes in glucose like potatoes and breads and pastas and those kind of things. And the spiking of the sugar and it staying up is what causes the diabetic problems. Now, type 2 diabetes was previously called non-insulin dependent diabetes mellitus, whereas now they're calling it more an insulin resistance. And insulin resistance, they're finding that the receptor sites on the cells in our body have, you know, in people who are healthy, they have a lot of receptor sites for insulin. In people who get diabetes, they are clogged up with other hormones, pseudohormones, which come from petrochemicals and these type of things. And so they're finding type 2 diabetes is going up. African Americans, Hispanic Americans, American Indians, Asian Americans, Native Hawaiians are the biggest risk for type 2 diabetes. And it's mainly because they take on the wrong diet. They're not eating what they were supposed to. This is a normal cell. Lots of these blue things are the receptor sites for insulin. In type 2 diabetes, you get fewer receptor sites actually, you do have all the receptor sites, but they're clogged up with petrochemicals that won't come off. And so the insulin can't work as well to get the sugar into the cell. Now, sugar is important. We actually make our energy through our mitochondria with the sugar and the ATP cycle, and the problem is we can't get it into the cell, so it accumulates outside the cell and in the blood, and that's where you get the high blood sugars. The glucose comes into the body, and the insulin helps get it into the various tissues. And normal glucose levels are 120 to about 110. When you get diabetes, the glucose doesn't go into the various organs and isn't used as energy. It isn't used up, and so it accumulates and causes the problems with the high sugar levels. Gestational diabetics is kind of an interesting thing. I dealt a lot with a lot of women who were gestational diabetics, and the same ones, the African Americans, Hispanic Americans, American Indians, and some Asians develop gestational diabetes. Some of them need to be on insulin while they're pregnant. And they found one of the biggest problems is the liver can only handle so much toxicity, and when you get pregnant, you produce a lot more toxins. You're actually detoxing for both the baby and the mother, and it builds up and makes the liver unable to detox, so you get more of the chemicals and the insulin resistance, which develops into gestational diabetes. And they found that women who have had gestational diabetes have a 20 to 50% chance of developing diabetes within the next 5 to 10 years when they are diagnosed with that. Other types of diabetes, specific genetic conditions such as maturity onset diabetes of youth. I believe this is actually flukes, not as in a fluke, but is in a parasite that causes problems. Surgery can cause difficulties. Anesthetics are found to be very toxic to the pancreas and can kill off the...
Are you talking about general surgery?
General surgery.
Anywhere on the body?
Yeah.
Because?
Yeah. The anesthetics they use are very toxic on the liver and the pancreas. So if
so it's the anesthesia part that's...
Yeah, if you've had surgery, you're more likely to get diabetes. Drugs, very hard on the pancreas and liver. Malnutrition, when glyphosate gets in there and we're not getting all the nutrition we need, it can cause diabetes. Infections, I've seen kids with high temperatures end up with diabetes after severe infection. And the high temperature can burn out the islets of Langerhans, the beta cells in the pancreas, and produce pancreatitis and insulin-dependent diabetes. It's quite interesting that sometimes, they just don't know what is causing it. They call it autoimmune. I believe it's infectious causes by parasites and viruses. There's another new term called latent autoimmune diabetes in adults, and what happens is they're older, so they don't get it younger, but actually I believe it's flukes that cause latent diabetes. Okay, the autoimmune is the body attacking itself. I believe that's an infectious cause. The body attacks the islets of Langerhans because of either toxins or viruses. And a lot of the patients with the latent diabetes are mistakenly thought to have type 2 diabetes based on their age at the time of diagnosis.
Can you address what it says type 1.5?
1.5. Well, we'll go on. There's a slide on that, so we'll address that. This is a foot complication. This lady has a big old ulcer, and her heel is all full of fungus. This is fungus growing in between the toes. And the fungus grows because they have high sugar levels, and the high sugar comes out through their sweat in their feet, and the fungus starts eating it. diabetic toes. You get toe fungus much more frequently. This is a lady who had necrosis on the upside of her foot. And as you can see, the whiteness around that's fungus just eating the tissue. And it makes it so it sloughs off, and you can see her tendons there even. Got an interesting story about a lady. This is a white person, Caucasian. When I was about 7 years ago, Vicki and I got the feeling we were supposed to up and move to North Carolina. And so we tested on a map, and it was Charlotte, North Carolina. So we got a flight and made arrangements to look for a house. And I mean, it was quite interesting. Both of us woke up looking at each other, oh, we're supposed to move to North Carolina.
Wow.
And anyway, we got there, and it was one of the amazing miracles I've seen in my life. We went to church at a local church, and they were talking about healing that day, spontaneous healing, and how the church had started, and this lady had sat in a chair and visualized Jesus being in front of her. She had tuberculosis, and she just, every day she'd sit there for an hour asking Jesus to heal her tuberculosis. Back then there wasn't any treatments, and people died from tuberculosis, and her doctors had told her she was going to die. Anyway, within 3 months, her tuberculosis was gone, and she was fine. And so her husband, being an atheist, he was like, boy, this is curious. How'd she cure herself, you know? And so he asked her, and he said, do you think I could do this? And she said, I don't know, you know. He says, I don't believe in Jesus. And she says, well, just visualize him being in front of you and healing you. And he had been ran over by a wagon and literally dislocated his hip and mangled his leg, and he was unable to walk without a cane. And it took him 6 months of sitting there for an hour each day, but his hip popped in,
Wow.
and he was able to walk without his cane. And so they started, that was the beginning of the first Unity Church, and that's what they taught people. Well, anyway, we went to the Unity Church there in North Carolina in Charlotte, and walking in, there was a black lady in the back row with a wheelchair sitting there, and she was like the scribe for the church, keeping notes. Her feet looked worse than this, both of them, and she was sitting there in the back, and I could smell her feet. They were necrotic. They were dying, and it was dead tissue. Anyway, after the sermon was over, we're walking out of the church, and this lady grabs my hand, and she says, Dr. Worm, well, she didn't call me that. She just said, sir, you're here to heal me. And I'm like, what? Here to heal you? And the day before, we'd had a miraculous healing, and so my faith was pretty high, and especially after, hearing a lecture on healing. And so I said to her, okay, I'll do what I can. So I visualized her feet being perfect, and I closed my eyes and did visualization and energy work on her feet and her body. And it was amazing, because her toes, instead of looking necrotic like this, they started to become normal looking. And I was very amazed, because she was going to get her foot literally amputated the next day, and she'd been praying to Jesus to have some healing. And after that lecture and listening to me do some breathing techniques, she decided I could do that. But I was actually just a conduit that literally her feet went from looking worse than this to being perfect.
Did you see it happening?
Oh, I had my eyes closed.
Oh.
But the preacher was there, Vicki was there, a lot of people had gathered around, and they watched it happen. And it was absolutely amazing. It was a miracle. But this is the complications from diabetes. We can get rid of these complications. 80% of adults recently diagnosed with type 2 diabetes have these autoantibodies that come against their cells. And what's interesting is in this LAD group, they shouldn't be using metformin, but I find them on metformin every day. Metformin is a treatment, an old treatment that was taken off the market back in the late 60s, and they revived it and started treating people with diabetes with it because it does lower blood sugar levels. They're also treating women who are infertile with metformin because it makes it easier to get pregnant. But I've found metformin ruins the liver, and that has not gone away even though they've revived it. So
Did they originally use it for blood sugar issues when it first came out?
when it first came out, they were actually using metformin as a type of chemotherapy, and so it treated autoimmune diseases and those kind of things. But because of the liver toxicity, they took it off the market. But then they tend to resurrect things. Like right now, they're resurrecting DDT, which was taken off the market because it caused, the birds their eggshells were soft and wouldn't get the calcium in them. And there was other things that the DDT was causing, but they're resurrecting that again, and the FDA and the USDA are allowing it because everybody running those companies now are associated with the chemical industry, and so they don't think it's that bad. Anyway, type 3 diabetes, in case you need another reason to cut back on your junk food, Alzheimer's could well be a form of diet-induced diabetes. And it's interesting because soda, donuts, processed foods, meats and fries, they actually cause Alzheimer's disease. And they found this through studies. And what's interesting is the type 1 can get it also because their sugars are always high. And what does high sugars do? It feeds fungus. And even though the medical profession hasn't recognized that Alzheimer's is a form of fungal infection in the brain, they are recognizing that high sugars are causing Alzheimer's. So it's quite interesting. They're thinking by lowering their sugars, you won't get the diabetes, but the problem is by then the damage is done. The amyloid plaques are in the brain. Amyloid means, if you look it up in the dictionary, means fungus-like. Now, why would they call it fungus-like plaques in the brain if it isn't fungus? That's the interesting thing.
I
Yes?
read something the other day on Facebook, not Facebook, the news. He was a famous golfer, and he admitted his bad habits, and he drank 16 to 20 Diet Cokes a day and 40 or more cigarettes a day.
Holy cow.
He's still alive, but...
he may have good genetics or just bad sense.
I couldn't imagine, can you even drink that much in a day?
Yeah. So the interesting thing in the New Scientist, they said food for thought, what you eat may be killing your brain. So be careful what you eat because you may end up with Alzheimer's. Of course, people who end up with Alzheimer's, they don't care anyway because they don't know. So the neuropathologist named Alois Alzheimer noticed over a century ago that an odd form of protein was taking the place of normal cells and causing beta amyloid plaques, beta fungus-like plaques. And in the medical profession, it's a mystery, but I believe it's fungus that starts growing in your brain.
So he noticed that a century ago.
Yeah.
And they claimed that there was no study or anything of Alzheimer's for the last few years.
Yeah.
Until now, it's never been.
And in a slide 2 weeks ago, they came out with a study that showed you're more likely as a woman to get Alzheimer's than you are to get breast cancer now, which is interesting. So I think both of them are due to fungus and parasites. It's interesting, when they block the insulin to the rat's brains, their neurons deteriorated. Well, of course they will. They're not getting any sugar. And the brain, believe it or not, lives on either ketones or glucose. And so if you block the insulin sites, of course your brain's going to deteriorate and have problems. And so it's not, giving insulin has actually been shown to cause depression. So when you're on insulin, you're more likely to get depression. But also I've found that people with diabetes have higher fungus levels. And so the fungus suppresses the brain, causes depression. So it's quite interesting. They're associating a lot of diabetic problems with the brain, and type 3 diabetes is Alzheimer's. Kind of interesting. Pre-diabetics, impaired glucose tolerance and fasting glucose levels progresses to diabetes. Now, years ago when I weighed 260 pounds, I was drinking a 6-pack of Coke a day, so you can imagine I was probably pre-diabetic, although, you know, I'd check my sugars and they were fine. But I was giving myself all this sugar through the Coca-Cola, and I developed malignant melanoma, which is what? Black fungus. So I was contributing to producing the melanoma because I was feeding the black fungus that was on my body. And so when I got rid of malignant melanoma, I quit drinking soda pops, sugars, those kind of things. And first 60 days, I lost 40 pounds. You know, it was a lot of parasites and a lot of swelling in my body from all the sugar problems. But anyway, when you look at this, I had pre-diabetes. And if I hadn't quit doing that, I probably would have developed full-blown diabetes. Okay, to diagnose diabetes, there's type 1, the beta cell destruction, usually leading to absolute insulin deficiency. When you don't have insulin, you die. So the treatment is to give these people insulin. Now, type 2 diabetics is different. And type 2 diabetics is either insulin resistance or just not enough circulating insulin. And so sometimes they have to give them more of the hormone insulin or help the pancreas produce more insulin. That's where, you know, Diabinase and all these different things are given to them. They found that a lot of people with type 2 diabetes are developing into type 1 where they need insulin all the time. So it's a huge problem, and they found that these people, if they'll change their diet, the diabetes will go away. But most people won't change their diet. They just keep eating the crap that's causing the problem. Okay, blank slide. Management of the diabetes, there's lots of insulin. There's rapid acting, you know, the regular porcine insulin that's just a regular type fast acting. They found that it doesn't cause as many complications. They found intermittent acting. They add molecules onto the insulin and it makes it last a little longer than real long acting, then they pre-mix them. They've actually found that the longer acting insulins are actually causing diabetes to worsen. And yet the doctors are prescribing these newer insulin products with chemicals on them that actually cause trouble to the cells, and they supposedly go in and they attach the cells and they last longer to get the glucose in, but they're actually toxing up their cells.
So when somebody's on an insulin pump, which type are they on?
Most time it's just a short-acting insulin that they just give them continuously, and it'll pump a little bit in.
It's not one of the rapid-acting?
Yeah, it's the rapid-acting.
Okay.
It's the more natural insulin. The longer-acting insulins are the ones where they add chemicals on to make them last longer. The chemicals that are actually causing problems. Oral hypoglycemic therapy makes the pancreas work harder. They actually found that in 1900, most people's pancreases weighed about 250 to 350 grams, not even a pound. Pathologists are, you know, when they do autopsies, they weigh each organ, and they found most people now, we have pancreases that are 2 to 3 times heavier than in the year 1900. And the year 1900 was when we started, you know, revving into the beet production, the sugarcane production. You know, everybody just got into the sugars, and it actually caused us to evolve and have a bigger pancreas with more insulin production. And so, kind of interesting. So if you use diet, so you avoid sugars and you exercise, and pastas, breads, white vegetables, including potatoes. If you don't eat those and you exercise, you actually make yourself more susceptible to insulin. And so insulin resistance goes down. This just makes your pancreas increase production of insulin, and then, of course, insulin therapy. Diet is a very basic part of management for diabetics, including insulin-dependent diabetes. If they gain weight, they become worse. So ensuring weight control, providing nutritional requirements, good nutrition, keeping the sugars under control helps a lot, correcting any associated blood lipid abnormalities. Now this is mainly what doctors do. They start you on statins and different things because diabetics get high cholesterol because they have a lot more inflammation in their body. So a lot of them end up on that, plus they have high blood pressure, and so they start them on blood pressure pills. So most diabetics are on between 12 to 16 medications by the time they're in their 50s. Most normal people without diabetes get on about that many just because the doctors start giving them stuff and they have to counteract a lot of the side effects. Okay, so dietary fat, it's interesting. Here they're saying you should provide at least 25 to 35% of total intake of calories with saturated fat, but it shouldn't exceed 10% of the total energy requirements. And they're saying, cholesterol consumption should be restricted and all this stuff. Well, I'm here to tell you, diabetes is actually a lack of good fats. Because a lot of diabetics are getting the wrong fats, vegetable oils, polyunsaturated fats, and they're finding now that butter is a better fat than margarine. And so, it's better for diabetics to eat butter rather than margarine. And yet, 20 years ago, they were telling them all to get on margarine. So, they found that coconut oil, very good for diabetics. And I believe a lot of the thing to do with coconut oil is it helps the cell membrane be more, let things in easier, so it makes the insulin resistance go down, plus it's a good antifungal. So coconut oil is really good for your body internally as well as externally. They found people who use coconut oil instead of sunscreen lowers their cholesterol, believe it or not, because it allows the sun to change the cholesterol into vitamin D, which actually protects your body from cancers and different things. So using coconut oil externally is better for you than sunscreen. Go ahead.
I saw an article the other day that says use coconut oil instead of all these fancy things you buy. The people in the islands use it.
Yes. Yes. And it actually helps the skin become tan easier and prevents burning. Another thing they're telling diabetics is excessive salt intake is to be avoided. I've found most people with diabetes, because of the high sugars, they lose minerals out of their body. They actually need more salt, but not the table salt. They need real salt because it's got all of the different minerals rather than just a few. So, saying excessive salt intake should be avoided. Well, table salt makes your blood pressure go up. It also only gives you sodium chloride, and the chloride is a bad thing in your body. But when you eat real salt, it actually has less of the sodium chloride, more potassium, more magnesium, more of the other essential minerals. Exercise is so important. I find that when I go walking and exercise, I not only feel better, but the tingling and pain in my extremities goes away. So I've got what you would call post-pancreatitis diabetes, because when I had pancreatitis, it destroyed a lot of my insulin-producing cells. I only have about 25% of the insulin that I did before my pancreatitis. So I have to be very careful with how many sugars I eat and careful with the fats I consume. And if I exercise, I feel much, much better because it makes the insulin that I do have work better. And I don't take insulin, I don't take drugs that make me produce more insulin, but I did do a lot of stuff to improve my pancreas because I was down to 10% insulin production, which is low enough you probably should go on insulin, but I never did. But physical activity really improves insulin sensitivity, so it helps it work better. Along with dietary treatment, you can get a lot of type 2 diabetics to not need anything. So I have to be careful with diet and exercise, but I would say I have type 1 diabetes because I lack insulin. But because of my knowledge of this stuff, I use other things to help improve my insulin production. So one of the things that people have to do is monitor their blood glucose. I don't do this because I figure, why poke myself and cause holes in my body? I can just intuitively go, okay, where's my blood sugar at? Right now, my blood sugar is 96, which is within a normal range. That's intuitively. I just asked the number, and that's what came to me, 96. I had a guy who used to come to me when I was practicing medicine up in Cedar City. He'd come in and he'd go, "Doc, what's my blood sugar?" And I'd give him a number. He'd say, "Draw my blood." So I'd draw his blood. We'd send it off. And intuitively, it was right on every time. And he was amazed. He kind of did that to me to test me, test my intuition. And it was funny because every time I was right on. It was fascinating. Body weight, keeping your body in a good weight. Like for women, 100 pounds at 5 feet. If you're under 5 feet, 95 pounds. But you go up and down per inch 5 pounds. So if you're 5'10" as a woman, 150 pounds is a good body weight for you. And it can vary, because some of us have bigger bones or smaller bones or whatever. But that's a good rule of thumb. In men, it's 6 pounds for every inch above 5 foot. So right now, I'm currently at my perfect body weight at 186 because if you times, 6'1" is my height, so 13 inches above, 100 pounds. So 6 times 13 is, what is it? 86. So I'm right, 88 actually. So I'm right at my perfect body weight right now. Foot care. Diabetics have to take good care of their feet. I've seen so many people with foot fungus and toenail fungus and all this stuff that is part of diabetes. When you have toenail fungus, it's actually a sign that the fungus is in your brain. Wow. So you got to be very determined to get your blood sugars down and control them because if you have toenail fungus, you're on your way to Alzheimer's. Personal hygiene. Use products that reduce fungus on your body because a lot of people with diabetes, they get all kinds of skin cancers. So if you're getting basal cells and melanomas and different things, that's fungus on your skin that's bad and it turns into cancers. So taking really good care. Healthy lifestyle, diet and exercise. And, they found smokers who are diabetics have severe circulatory problems. The combination is very bad and can cause stroke, increase in stroke, and loss of limbs, all kinds of stuff. Okay, does anybody have any questions?
I do. What is this? Explain how or why this news, they're talking about people that they do the belly band surgery kind of thing for the different kinds of weight reduction surgery,
yes,
where they remove part of the stomach and those.
Yeah, band surgery.
How is that working? Why is that happening?
Well, it makes people lose weight because they're not absorbing their nutrients. And so they lose weight. But they're also finding these people become nutrition deficient.
Right.
Because the parts of the gut that help you absorb your nutrients. See, when God made our bodies, He made acid in our stomach to break down proteins and kill parasites and kill fungus. When you take antacids or you alter the stomach lining in any way, shape, or form, it bypasses that initial defense. And so you get changes in your microbiome. They're finding that a lot of the bacteria in our body actually help our immune system, help us decrease insulin resistance. If you have better bacteria, they help you absorb your proteins. And actually, you don't want to absorb proteins because large macromolecules, when they get absorbed in your blood, your body doesn't know what to do with them because the enzymes are created in your liver and your pancreas to break down the proteins into amino acids. And those amino acids are what's supposed to be absorbed in your body, and then our body takes them and makes the proteins our body needs.
They
Whereas,
say instantaneous, how can that be? They cut their,
oh yeah, it cuts out your nutrition. Instead of absorbing
okay.
foods, you know, it just goes through your system. A lot of these people have chronic diarrhea, chronic problems because they're just, you know, they don't have any way to absorb the food, so it just goes straight through. And a lot of these people are getting leaky gut.
Yeah.
And it's creating celiac disease, it's creating autoimmune disorders, it's creating food allergies, all kinds of stuff. So I don't recommend it for anybody.
What about all the antacids on the market? I mean, it seems to me that's doing more harm than good. These people live on whatever they do.
Yeah, it does reduce the acid, and that acid breaks down the proteins. And most of us are protein deficient, believe it or not. And the reason so many people crave food is because their body's craving some good nutrition, but we feed ourselves crap and just propagates the problem.
But we're craving the protein that's been broken down into the correct amino acids.
Yeah, we
not
need,
the-
and that's why supplement stores, you know, when people come in to get their muscles big, they'll get glutamine and creatine and acetyl L-carnitine because their bodies are lacking amino acids. And one of the things I found with my pancreatitis, I didn't have the enzymes to break down proteins. So I started losing muscle mass. And now that I've got my pancreas and my liver working better, using these kind of products, I'm actually getting my muscle mass back, which is good. That's a good thing. And muscle mass helps us burn sugars. So, you know, the whole process is helping me get healthier. So diabetes is, you know, not just a lack of insulin, but a lack of our cells being able to use the insulin, get the sugar in, and burn it as energy. They found people who exercise have more energy because they have less insulin resistance. And so, you know, my takeaway today is there are good treatments that you don't have to go get on these drugs that actually push your pancreas to die or whatever. You can take, the reason I pulled these out, this is one by Daeun Kim. It's totally vegetarian, helps the pancreas. I used a lot of this to help get me through my pancreatitis. Dr. Christopher's pancreas formula. I go to different products because your body gets used to stuff, and so you switch up and it'll work better. This one is kind of a neat one. This is put out by Professional Health Products. It's actually got a homeopathic in it that gives you insulin-like energy. I actually made a homeopathic when I was at my worst. I made a homeopathic with insulin energy. So it would go into my cells and mimic insulin, even though I wasn't taking insulin. It was just the energy of the insulin. Go
Maybe
ahead.
I've been paying attention a lot. Do you usually do diabetics parasite yeast?
Oh,
Start out
absolutely.
with that?
Absolutely.
That's the foundation?
Yeah, the foundation of diabetes is flukes and too much fungus in your body.
See?
And sometimes virus, because I found virus causes the diabetes too, and autoimmune. Autoimmune just means your body's attacking itself. And it's attacking itself for a reason. There's either chemicals, toxins, virus, bacteria, fungus, or parasites, and that causes autoimmune. So, treating those causes helps a lot. And, when I got my pancreatitis, it was due to a chemtrail dropping a mycoplasma that had a virus in it that caused the pancreatitis. And when I got my pancreatitis, there was 80 people that I knew of here in St. George got pancreatitis the same time I did. 40 of them came to my office and got treated. They're all fine. They all don't have diabetes. They all still have their pancreases. The other 40 went into the medical system, and I didn't hear what happened to them, but I heard about it. 60% of them died.
Oh, my gosh.
And which, if I'd have gone the medical route, I probably would have been, I was told by my angels, I would be one of the ones who would have died. So I would end up, mine was so bad that it was eating up my own pancreas, so what the medical doctors do is they remove it. And they do what they call a Whipple procedure, which is where they have to remove everything with the same blood supply, so they remove part of your stomach, your pancreas, and part of your intestines. And those people that get that procedure end up having to be on insulin and enzymes their entire life, because the pancreas produces most of the enzymes to break down our food to help give us nutrition. So pancreas is very important. And luckily mine's there and it's working, and even though I've only got the herbs help me get through without having to take insulin and enzymes, because they help provide some of those things. Any other questions?
Type 1.5?
What?
Type 1.5?
Okay. Let's go back to the slide. See, that's what's weird, is this one wouldn't show the little guys on it. Type 1.5. It's down here somewhere. Is that it? Nope. But we'll go through it. I think type 1.5 is mainly insulin resistance, and your cells just need insulin because of resistance. Is type 1.5. I had a slide, maybe it's on the other thing. It's on here somewhere.
In the middle.
Yeah. Okay. Late onset autoimmune diabetes of adulthood is considered type 1.5. So it's you don't get it early in life, you're getting it later in life, but you're insulin dependent. So
it's more like type 1 or more like type 2?
well, if you got 1.5, you need insulin. Yeah.
And
yeah,
that's
you have to take
type 1?
Yes, type 1 you need
That's
insulin.
the worst one?
Yes. And more people are getting this latent diabetes, and I believe it's due to petrochemicals and glyphosate and those kind of things that attach to the cell membranes and make it so the insulin just doesn't work. So you need more and more insulin.
Would something like humic acid or something like that help? Are there products that will help clear the cell of that? What's the best thing to do?
The best thing to do, believe it or not, when I was practicing medicine, I would do chelation therapy on people. Chelation therapy would lower people's blood sugars. It'd make the diabetics need to use less insulin. Now, what does chelation do? It removes toxic petrochemicals and heavy metals. So it removes the things that are toxing up the cell that's causing the diabetes. So if you can remove these chemicals, you can make yourself not be diabetic. And so I recommend to people with diabetes to chelate, either use an oral chelator or go to somebody who does chelation therapy, because removing the heavy metals and toxins decreases your blood sugars, helps get rid of your diabetes. When I did my own chelation years ago, I was borderline diabetic, but I was 220 pounds still. And when I would do chelation, my blood sugars would drop just because of cleaning out all those toxins and heavy metals. And everybody I was doing chelation to, their blood sugars would drop. You know, we'd have to get them to eat. Sometimes during the chelation process, because their blood sugars have dropped so dramatically. And vitamin C helps diabetics because it reduces the inflammation, and inflammation causes insulin resistance. So
wouldn't that plant, wouldn't that be good for diabetics?
oh, absolutely, absolutely.
Don't have.
I highly recommend, if you've got diabetes, clean out your toxins. The detoxification program, I've had people who have had to be on insulin be able to get off their insulin but they're usually type 1.5, the latent diabetics, because they still are producing insulin, but they need insulin because they're resistant. But the detoxification program reduces their resistance, and so they become, not needing as much insulin. Go ahead.
So can you ever get back to like normal sugar levels?
That's my goal with myself.
That's
And I've got, most of the time I have normal sugar levels unless I get into stuff I shouldn't.
But I mean,
Like those sugar cookies back there. I ate one and boy, I felt immediate. I'm so in tune with my body, I felt my sugar went up to 250 and it was like, ah!
Sure was
So-
good though, wasn't it?
Yeah, it was really good, but it wasn't worth it.
So, as a diabetic or parasite cancer,
Oh, absolutely. I would recommend for diabetics, treat their dogs, treat their cats, treat their kids, treat their husbands, because you don't want to get these flukes in your body because they just go in and they eat up more of your pancreatic cells.
So which is most important?
Where do you start?
Yeah.
Do you start with parasite or the fungus?
Well, go to an intuitive and ask them, do I need to do parasites? Do I need to
Do you
do
know any
this or
good
that?
ones?
Yeah. You know me, I'll put you on a parasite cleanse. I found...
That's the reason we're asking, because
Yeah.
you always start with parasites.
I start with parasites because fungus hides in parasites. So you got to kill the hiding place, and then kill the fungus. And I tell you, I get more people healthy just doing parasite cleansing and antifungals.
is there anything you can use or take to keep from reinfecting yourself? I know you told me to do your parasite cleanse after you do this usually, I think 4 times a year, but especially since I travel a lot in
Yeah.
strange countries.
The problem is we're going to get exposed to these things. And if
Yeah.
we don't have the acid in our gut to kill the parasites, which most of us don't have enough acid, you're going to get parasites. So I tell people do a parasite cleanse at least minimum of twice a year. Hulda Clark said if you do it twice a year, you'll never get colon cancer. I don't want to have a colonoscopy. I don't want somebody sticking something up my hinder and
They have
looking
parasite
around.
cleanse with you. They do it while you're over wherever you travel.
Yeah, so where is the worst exposure? What food?
It's so ubiquitous, which means it's all over the place. And we have, think about where your food's coming from. Usually Mexico, South America, because we're not eating GMO foods. Obviously, we can't buy it here. So it comes from other countries. And, some of the safest food probably has the most parasites. So, it's just one of those things where I believe we need to do parasite cleansing.
Can you get it just from your garden too?
I believe that you can. Now, what they found is, as the pollens are going around and seeding the seeds of deception or destruction, they're making all of our food GMO. The genetically modified organisms have a marker of antibiotic resistance. Now, what that means is if you're eating any kind of genetically modified food, even unknowingly, because the pollen can come into your garden, you are getting the genes for antibiotic resistance into your body. It goes down into your good bacteria and changes them into bad bacteria and allows more fungus to come in. It allows all kinds of things to happen. So the best thing to do is eat as good a diet as you can. Stay away from petrochemicals, you know. I was up at Systemics, you know, hearing this stuff. Vicki calls me up and says, "There's a 6-wheeled vehicle out here spraying everybody's yard." And they were spraying the concrete out in front of her house, the city of St. George, paying people to come and spray Roundup so we don't grow weeds in the cracks. I mean, that stuff is blowing over onto our lawn. Our kids are out playing on the lawn in their bare feet, exposing themselves to what? Chemicals that are causing diabetes. And it's a major problem, and we need to educate everybody because it's only going to get worse because of all the chemicals. There's a dead zone in the Gulf of Mexico that has increased. When I started talking about this, it was 500 miles below the Mississippi River Delta. The entire area there was no fish, there was no brine shrimp, there was nothing because all of the stuff coming down